Hello everyone. Let's learn about palliative care. Palliative care is the active holistic care of patients with an advanced and progressive illness, management of pain and other symptoms, and provision of psychological, social and spiritual support is paramount. Key principles of palliative care. The major domains of knowledge covered by palliative medicine training are the hospice and palliative approach to care, death and dying, psychosocial and spiritual support including support for the family, assessment and management of pain and non-pain symptoms and suffering, communication and teamwork, ethical and legal decision making, quality improvement and research methodology in populations with advanced illness. WHO definition of palliative care. Palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illness through the prevention and relief of suffering through early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Palliative care provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, intends neither to hasten nor postpone death, integrates the psychological and spiritual aspects of patient care, offers a support system to help patients live as actively as possible until death, offers a support system to help the family cope during the patient's illness, uses a team approach to address the needs of patients and their families, including counseling if indicated, will enhance the quality of life and may also positively influence the course of illness, is applicable early in the course of illness in conjunction with other therapies that are intended to prolong life, such as chemotherapy or radiation therapy, and includes those investigations needed to better understand and manage stressing clinical complications. WHO definition of palliative care of children. Palliative care for children represents a special, closely related field to adult palliative care. WHO's definition of palliative care appropriate for children and their families is as follows. The principles apply to other pediatric chronic disorders. Palliative care for children is the active total care of the child's body, mind and spirit and also involves giving support to the family. It begins when illness is diagnosed and continues regardless of whether or not a child receives treatment directed at the disease. Health providers must evaluate and alleviate a child's physical, psychological and social distress. Effective palliative care requires a broad multidisciplinary approach that includes the family and makes use of available community resources. It can be successfully implemented even if resources are limited. It can be provided in tertiary care facilities, in community health centers, and even in children's homes. Goals and objectives of palliative care. Palliative and hospice care are devoted to achieving the best possible quality of life for patients and their families facing a life-threatening or terminal illness through relief of symptoms and aggressive management of other sources of suffering. Interdisciplinary care addresses physical, psychological, social and spiritual needs. Students training in nursing, medicine and ministry will improve their knowledge of palliative care and symptom management, improve their knowledge and appreciation for the spiritual needs of patients with terminal cancer, achievement of the best quality of life for patients and their families, to maintain the comfort, choices of a person who is recognized to be dying in the terminal phase, to support their individuality, to care for the psychosocial and spiritual needs of themselves and their families. Thank you, my friends.